this topic, I think, has really obviously come onto people's radars. In a lot of ways, in the past couple of years, few years, there's been some great things, awareness and acceptance. And then with that, the other side of the coin comes harassment and hatred. And it's just, there's this tension as the field becomes more in the public eye. How are you doing?
It's a really hard thing to have medically necessary care and your job politicized to a point where, a lot of us receive like threats of violence and, have genuine concerns of our physical safety. And yeah, it's sort of scary how much like someone's healthcare has been politicized to the point that it's becoming this issue that is like radicalizing people to incite violence. And I think the saddest thing is so much of this is based off of like misinformation and inaccurate representations in the media and a lot of social media sort of. You see in a lot of these anti-trans legislative sort of hearings, a lot of things being pulled from social media or media articles, and it's the rare experience to actually have trans patients and gender affirming experts speaking to the reality of care. So it's just gotten so bad really quickly. And yeah, it's just hard, I think, for everyone in these spaces, especially for patients.
Yeah. Well, I think, you show a lot of bravery. I mean, look, even as I'm like the smallest little thing, like just writing my audience like a notification about this event, I was like, am I going to get like hatred that I am not accustomed to? I was like, oh my God, this is like 30 minutes of my life. It's nothing compared to what you have to go through. So I really hats off to you for being on the front line. And I want people to just, let's get away from the politics for a second, just to know what you do. Because when I was a medical student, I scrubbed into a lot of cases, appendectomy, and I scrubbed into a liver transplant. Like, you're a surgeon. Tell us, are these surgeries difficult? Are they complicated? Tell us about just the technical aspect of it.
Yeah, I mean, they certainly can be. I mean, gender affirming surgery in particular is like, that's such a huge umbrella. Like, so many things fall under that category. So, some of the simpler procedures might be something like a breast augmentation or maybe a mastectomy, but sometimes that can include like, pretty sort of technical reconstructive facial surgery, like facial feminization surgery, or more complex genital procedures. So it can be even something as simple as an orchiectomy, or simpler procedures like laser hair removal are all types of gender affirming, because it's all about treating the areas that are causing people either dysphoria or stopping them from having euphoria and feeling positive about themselves and right in their body, so that they can function better and feel better and be happier, better versions of themselves for the world. So I think, I kind of describe gender affirming surgery as, it's not like any one thing. I think it is using sort of surgery as a tool to help someone kind of physically actualize their internal sense of self. And that sounds a little like potentially vague, because it's different for everybody. Like, everybody's experience of gender is different, as is their experience of dysphoria. And it would be kind of silly to think that the exact same procedure is how you're going to treat every single patient that experiences gender dysphoria. So that's what's, I think, challenging about it, but also unique about it in some ways. Because you're pulling a lot of humanity into medicine, which wants to be like very algorithmic all the time. And I think that's, something that is the best part of my job, is understanding my patients and getting to know what they need from me, and really balancing, minimizing risk and maximizing benefit for them.
That's a great answer. And so that's like, to think about, how the OR can be, look, the operating room is a place where technical expertise plays out. And I think people forget that like some of these things are really straightforward, and some of, just like all of medicine, other things are not. But just to remind people that, like, you're a surgeon, like, you know what you're doing, what you're doing in there. And all the training that comes with that. So thanks for going there. Let's talk a little bit about the hospitals and the work environment, because you get threats, hospitals, physicians get threats. And from just the perspective of someone doing this, you sort of answered this up front, but do those threats and those difficulties make the actual job harder, or is it more like after you're done with the job, it's like you have to think about that?
No, I mean, it absolutely does because it reflects what a lot of the trans and gender diverse community is dealing with as well. And, as someone that has patients from across the country, people are scared that they're going to lose access to care like at any point. And wait lists for some of these procedures are really, really long. Like I have people waiting years sometimes to see me. And when you're taking on a major like life-changing decision like surgery and there's a million other things to think about and plan about, the last thing you want is this threat that you could lose access to care at any moment. It's very destabilizing, especially in a world where you're being persecuted for who you are. So people are coming up to clinic really stressed and like sometimes panicked. And when we're both getting it from both ends, where the provider is also dealing with like concerns of physical safety and everything that goes into that. It's I think it takes a lot of strength on both sides to hold that space and still make sure that good medicine is happening, while doing your best to really address what's going on socially and politically, because I think we as providers are responsible for our patients' health, and that health is affected by things far outside of the walls of a hospital. So I think it really is our job to be engaging socially and politically, to protect the people that we say we're here to protect and take care of.
How are the organizations doing, the larger organizations? Because a lot of times, experts, advocates, it's sort of they're pushing for something that is outside of the normal way of doing things in the past, or they're pushing for progress. And a lot of these institutions are very conservative and old and don't want to change things. But I haven't gotten the sense, as a relative outsider on this conversation, that like
Yeah.
people are coming out to the hospital, like people to say like, oh, you're not doing enough to make this available. Like I don't sense that like the bad guys, so to speak, are necessarily like the hospitals, which is kind of a little surprising, like in a way. Is that the right? Am I reading the room right?
I'd say yes and no. I think the absolute sort of false picture that's really been portrayed in the media with the amount of coverage, I think everyone's gotten this understanding that gender affirming care is like super easy to access. It's actually incredibly difficult to access. It's only with recent insurance changes from about 2014 that people could even access like insurance covered care. Um, and there's a lot of states that may have like one gender affirming clinic. There may be one surgeon providing care to huge populations of people, which is why this legislation is so scary. Because if you lose a single provider or a single even center, that may be an entire state that no longer has access to care. So that's what's kind of hard to sit back and watch, is people have this idea that it's like so incredibly easy to access care when the vast majority of the community has never had access to care in the first place. So I actually spend a lot more of my time like helping hospitals and training other surgeons and helping people like build gender affirming surgical programs, because there's still nowhere near the number of programs, surgeons, and centers to even come close to meeting demand. And you kind of brought up the point about like things being new. Like the reality is gender affirming care, or the need for gender affirming surgery and care, is not new. It's just we've chosen to look at it for the first time. We've completely oppressed the
Right.
needs of trans and gender diverse people for decades. And it seems new to you because we're even giving it space to even talk about it in the first place. And, that's why some of these wait lists run so long. Like there's people that are for the first time in their life at 70 or 80 years old transitioning because they actually have insurance coverage to do so for the first time ever. And what's sad is that, we finally are starting to get somewhere, but it does feel like that is being threatened. But I think a lot of the media attention too has created this, I think, public perception that there's this like debate about gender affirming care in medicine. There isn't a debate. Like every major medical organization overwhelmingly supports gender affirming care as medically necessary care, as do the vast majority of physicians. I think the fear, though, of public backlash and heat is where a lot of institutions can sometimes fall short at really standing strong in those statements and supporting and protecting the providers that are providing that care. And that's been a mixed bag, seeing how people have handled that across the country.